My name is Claver Matongo. I'm from Africa, Zimbabwe. I had a heart attack on May 8th, 2015. I visited a specialist in Zimbabwe, and then I was put in the hospital for 8 days. And then he said, for further treatment, I have to go outside the country because in Zimbabwe we don't have the technology. So we consulted South Africa, we got the reports. We also consulted India, different hospitals in India, we got reports. But finally, as a family, we were agreed on Max International Hospital. My son Rodney was the one who was now responsible in communicating with the Doctors Beyond Borders. And from there, as I said, we got the quotations, but one from Doctors Beyond Borders was the one that we chose. And as a result, we made some preparations to come. They did many things for us, which was very helpful. For example, we were given the quotation, and the quotation was in detail, including the accommodation, and also the time that we spend in the hospital, and the time that we spend outside the hospital, and also the arrangement of visa. It was very easy when we went to Zimbabwe embassy, because they had also information about our going to India. And our doctor in Zimbabwe was very happy that we have chose India for treatment.
We met Doctors Beyond Borders at the airport. They were waiting for us, and they had our names on a placard. So we noticed them, and they took us to a car which was waiting for us, and then they took us to hospital. It was very easy for us since this was our first time in India. When we got there, we went to admissions department, and they did all the work, and then we were told which ward we were supposed to go in. And so they were very helpful, and my husband then was taken in for some examinations right there and there, the same day. So everything was done promptly. And I really thank Doctors Beyond Borders, because they were always there for us. We even had the WhatsApp number of one member of the Doctors Beyond Borders. So whenever we needed anything, we would contact him, and he would come promptly to the ward to talk to us. Even when my husband was in the ICU, they would come and visit him, and also come and give me assurance. I was even given accommodation for the day when my husband was in the ICU, since I couldn't stay in the hospital. And all that was a result of the work of the Doctors Beyond Borders. I really thank them. And when it came to time for discharge, they were there again, ready to help as to where we were going to be accommodated. And up to today, we are still in touch, since we are still in India. Any problem, we have somebody to talk to.
Since I was an international patient, I did not feel as I am lonely or feeling that I was away from home, because the arrangement was made from Doctors Beyond Borders to have visitors seeing me at the hospital, even visiting my wife at the hotel when I was not there. So everything was excellent for us. The doctor was very friendly. I come to like him because of the way he treated me. And at the end, he used to call me a friend of mine. So we had a very good relationship with the doctor. My main point of coming to India was for the heart to be unblocked. But when I arrived, the doctors here, they let me go through another examination, and they found that just having an unblocked heart is not enough. They had to put something in my heart which is called pacemaker. So I agreed on that because having a pacemaker, it was going to help me. It will help me that I'll never have another heart problem, and then the heart will function very well. When we left Zimbabwe, we expected to be in India for 21 days. But with the quick action that the doctors took, we were in the hospital for 8 days, and we were supposed to come back for another review that was 2 days. So it was very quick for us. I would like to encourage those who are sick, if they can arrange their affairs and come to India, definitely they will have a good treatment, as I've experienced that. The arrangement to see doctors beyond border is very simple. If anyone wants to contact them, they can do through email, and they are very prompt to help anyone who want to know about his condition or how he is going to be treated. I now have a new life, and I wish them the best.